I'd like to join this conversation, and I want to thank Mr. Professor Marcello Villanova for his honesty and practical experience in management of these patients. So that's the most important thing. We heard in this speech not what is done in the world of science, but we felt how important it is to have your 20-year experience, which you've shared generously with Ukrainian specialists. We really appreciate it. Thank you. Also, I want to say that I also have quite big experience, more than 40 years of practice of work with all populations, not only with 7 patients. I remember the first publications of the book about Duchenne disease, Polish publications from Professor Gusmanova. It was in 1970s. And I remember the practical experience which Ukrainian doctors took when the parents came and couldn't believe that the patients with this disease cannot be helped. And I remember these stages of our Ukrainian search. But first of all, for some reason, we had the period of time when we referred these patients to the USA and they tried to find biological biocomponents there, like in the previous century. And we thought that maybe it can somehow improve their condition. And also, after that stage of biological supplements, we used neuroprotectors, vitamins, groups, and it was really the whole era of all of these medications. And then again, we understood that it gives no effect. And to date, especially parent society is waiting for the miracle from target therapy, the therapy where the medications are used, the medications which can influence gene therapy, so-called. And I want to thank you very much for grounding this huge miraculous desires of parents to receive some significant changes that would significantly improve the condition of these patients. In your speech, I really liked absolutely everything that is about walking. Walking is highly important and something that's related to the food. I have already taken this experience and I understand how food position is important. And really, I liked your approaches from the point of view of surgery treatment that Oksana has mentioned, and your approach to steroids. I will not stop for a long time on that. The only thing I'd like to highlight, which is important for me, and it relates to the fact that we cannot repeat and create the second Marcello Villanova in Ukraine. I don't think someone in Ukraine can deeply understand how to provide the ventilation and how we can learn, how neurologists can learn absolutely different specialty for us. So I'm on the stage of multidisciplinary approach. I'm on the stage that we have to cooperate with anesthesiologists and other specialists here and now. And I'm already thinking, and I will also ask you about that later, that it's really important to have the cooperation with the specialists who understand palliative aid, because all the points you've mentioned, especially ventilation, cannot be done without deeper knowledge about these patients among other specialists. And I will not continue saying more compliments to you. You deserve all the compliments. You are really the specialist of the highest level. So I want to invite you to further cooperation with Ukrainian doctors. And I hope that you will not say no to us, and we will try to agree this process with Margarita Yashchenko or Oksana Nazar about how you can do the workshop with us, not to have the lecture for 1 hour, but so that we would be able to work with you at least a few days. And that would be really the most valuable service from you to Ukraine, which really requires it. and during the war with Russian aggression. I kindly ask you not to deny and refuse, and in 2023, we kindly ask you to work in this direction with us. Now, may I ask you a few questions? The first question is about the notion that to repeat one more Professor Marcello is impossible. So in your opinion, is it really relevant to continue in Ukraine to create multidisciplinary teams to help these patients? What level of knowledge should neurologists have from all the volume of knowledge, and where other specialists are necessary? That was the first question. And let me ask you the second question right away. In your opinion, where should these children get the treatment? In what institutions? Should that be ambulatory centers and rehabilitations, or clinics, separate clinics? And in general, what do you think? Do we need some one central methodological center to help children with progressive neural diseases, and in particular with Duchenne disease? Thank you. These are the first two questions.
Yeah. First of all, thank you very much. And, you know, I tried to do my best in my life. And the problem is that, for example, I work in a little hospital. I didn't get the possibility in Italy to enter at university, but because Italy is a very complex state. For this reason, since the beginning, since 1998, I started to work in hospital. They are not a university hospital. They are a small one. And I didn't have the possibility to have all the specialists around me. And my idea was just to try to study as much as I could to be a supervisor. So to try to understand myself what were the problems with the lungs, with the cardiac, physiatrics. For this reason, I went around Europe and also in the United States to try to understand these things. I think that the best thing is to have a multidisciplinary team. But you have to say that, you know, it is not always easy. What I suggest you is just try to, I'm an atypical neurologist. You need an atypical neurologist, not a typical neurologist. You need someone that start to understand the study several fields of the neuromuscular disease. It can become like a supervisor. Then you can also teach to the anesthesiologists, to cardiologists, but you need yourself experience. This is the best way to start. Of course, it's very important that in Ukraine there is a center. So if you have a center in Ukraine, you need only one. In that case, everyone can come in the center, can learn in that center. The center can become probably a school teacher center. And I think that is very important that all the, if you have to put money, for example, on the clinics in this moment, also in Ukraine, you should try to really create only one center that works. And in that case, you have several figures. You can have young people that want to try to start with such kind of disorders, become a super specialized neurologist. You will see that slowly, Ukraine will be as probably other countries. What I can tell you is that in Italy, not in all regions, there is knowledge of muscles. I see in Bologna people coming from all the regions in Italy. And I can tell you that also in Italy, we have a lot of problems. There are also today, many hospitals, they do not know much about the muscle disorders. Fortunately, thanks to the association, family association, thanks to probably a little bit of Teleton, now in Italy we have more centers in the big city that are called NEMO, neuromuscular centers. And these are good, and generally a family doesn't need to do 1,000 kilometers to go by a specialist. you can have a specialist in 200 kilometers from your house, for example. But until a few years ago, really, also in Italy, there was a big problem. Then now the situation is better, and probably Ukraine will be the same. You have to start. And when you start, you will see that later on, slowly, you will have more experience and everything will become more simple. And your patients, I'm sure they will be very happy because their life will be much better than now. You can avoid surgery if you follow all the stages. You cannot wait that a retraction form. You have to just start when there is no retraction. And you have to teach the family and let them to understand, also the boys, that it is very important to prevent. If you prevent, your life will be much better. If you arrive too late, then it's impossible, because when there is a bad scoliosis, it is too late. When you have a bad retraction, it's too late. When you know the foot, you have already retraction of the ankle foot that is important, then it's too late. So for this reason, less invasive we are, better they live. For the rest, you know, I would like to collaborate with you, no problem. Probably once come in Bologna, and you know, it's also my story is a very strange story, because we didn't have war in Italy, but we had COVID, probably as you had. And my unit in 2021 was closed because we had to give space to COVID. And for example, I was working in another hospital, I had 14 beds, and they closed my unit because they say, you know, we need the places for COVID. And all my patients were on the street. Now, since 2 months, I open another unit in another hospital. I have 8 beds, not big one. It's very nice hospital, this one. But it was incredible. For COVID, they closed my unit because, you know, they have to give places to COVID. It's incredible. But, you know, Italy, for me, is not probably different from Kiev in this moment. Okay. But I will be very happy if someone of you comes to Bologna. Probably can spend a few days with me, and in that case, you can learn much quicker. Okay. I'm very close to you as people, so if I can help you in some way, I will help you.
Thank you very much for your response. This is extremely pleasant for us that our meetings will continue, and I would like to go on with my questions, if I may. I think I won't take a lot of time. If too long, Oksana will interrupt me. I'm interested, dear professor, I'm interested in how do you cooperate with palliative therapy departments in Italy. In Ukraine, we also have palliative therapy departments in Ukraine. And you talked, for example, about adult patients. Do you, it's the second question, whether you separate adults and children patients, and how do you cooperate with palliative therapy departments? 2 questions in one.
Yeah, okay, I understand. First of all, I have to say that today the medicine is not really prepared to take care about the people that they cannot cure. So for this reason, the palliative medicine and the curative medicine should work together, no? But in Italy, generally, the families are the palliative hospitals, because Duchenne, also 40 years old, they live in the family. Incredibly, the mothers, they have the biggest work for these people. The problem is that when, you know, children become adult, and now I have many adults with Duchenne. They are 35, 40, 45, and the parents are very old. And for this reason, sometimes, you know, they are not able to assist their kids. But, you know, unfortunately, in Italy, we don't have such kind of mentality like hospice where you can do palliative medicine. You have some for cancer, you have some for amyotrophic lateral sclerosis, for example, because in that case, you know, you are still older than a Duchenne when you become sick. But in the most, well, all the families that I follow with adult Duchenne, they live in their families. And for this reason, they live in their home. The palliative, we teach them how to do, we teach everything, how to use solvator, everything, but they live at home. Then I don't have much contact because they do not exist in Italy yet, hospice for such patients. And you know, the life of a mother is destroyed because many times these women, they were working and they stopped working. So these families, they get a lot of problems because, you know, generally one member of the family become assistant, and 99% of the time is the mother. The father goes to work, and the mother lose her life, lose her job. This is, you know, we work a lot on psychology because these women that, you know, they really need a prize, because many times we give a prize to everyone, but we should give a prize for these women because they really destroyed their life just for their son, and they are very clever. They will never leave a son, also if he's 40 years old, to go in hospice, palliative hospice. I can tell you, this is really, in Italy is like that. For example, in Japan, I know that is much different. When they are 18, they make them tracheostomy and they send them to this hospital, palliative hospital. But I don't know which kind of life these boys can do in a palliative hospital, because they are really depressive so many times. I prefer that they stay home and they can live their life, because I think is the best way to have a good quality of life.
Thank you very much. Yes, Italian experience is closer to us and more understandable, so we accept the way you talking about it. Oksana, I think there are other questions from other participants. I won't take any more time. Yes, thank you very much. I do have a question for Professor Vilanova. The question is regarding organizing the medical aid to such children. I know that mostly such children, such patients come to a physician for one day for a consultation, corrective therapy, and then they go back home with recommendations. You said that you have a department with beds. In which cases you recommend hospitalization, and how long can hospitalization last, and what does it depend on?
Okay, so generally when a boy with Duchenne walk, I don't take them in the hospital. I see them just in outpatient clinic. I do a visit and I give suggestions. Eventually, can stay just a few hours if we need to make some orthosis. I hospitalized a patient with Duchenne when you need to check the scoliosis, the heart, the respiratory. So in those cases, I generally let stay them for, it depends, sometimes 1 week, sometimes 2 weeks. It depends by the problems. And in these days, they do everything. We check scoliosis, and we do the corset, we work on the wheelchair, we do on psychology, nutritionist, we check the heart, and they do physiotherapy every day, more or less 2 hours. So all these things, they are paid by the health system. So the families doesn't pay anything in Italy. When they come in the hospital, they can stay 1 week, 2 weeks, it depends. There is a prescription made by the general doctors that ask to the clinic to help their patient. And in 7 days, maximum 10 days, I try to do everything. So if I need a corset, or if I have to ask some consultation from some specialist, this is the way. So I do these works more than 20 years, and I do always the same. I don't put inside in my hospital kids 5 years, 4 years old with Duchenne, because you don't need to do it. And probably it's better if the kids are out of the hospital as possible as they can. Unfortunately, if you come from another country, you have to pay. This is a problem. And sometimes, you know, people from Ukraine, Russia, they ask me, you know, I want an help, and I let them, okay, come in Bologna. I will see you in a visit. I can do a visit, but it becomes very frustrating, because then you let people come back in your country, and probably the boy needs many things, and probably these countries are not able still to give this kind of aid that boy needs. This is also, for me, is frustrating. But if I ask a family, okay, you can stay in my hospital for 7 days, we can try to do everything, then you need to pay. This is a problem, because you are not covered by the health system, Italian health system.
Thank you. And could you please tell us about your experience, what hormonal medications you use and in what mode? Because once again, you presented there are certain modes. What is more preferable to you? What is the mode of prescribing medications, hormonal medications?
So you are asking me about hormones. So hormones, you mean growth factor hormones,
Yes.
not steroids.
Стероїди, ні, про
No,
стероїди.
I mean
Okay,
steroids.
okay.
Steroids.
Steroid, no, because sometimes, you know, about the low stature, about sometimes you can have also problems with sex genitals. So sometimes, you know, parents ask also hormones for other things. But anyway, steroids. I generally start, as I told you before, I start with when they are 3, maximum 4 years of age. It depends if I can do some tests and then be sure that the steroids works or doesn't work on that boy. I start with the 10 days yes, 10 days off. And this is my first scheme. Then I ask the parents to come after 6 months, and I try to understand whether that schema improved or not the boy. You have to think that until the age of 5, all boys with Duchenne improve. So you don't need either to. So if you don't give any steroids, they will improve the same, because Duchenne until the age of 5, the strength improve, then become stabilized, and then they start to go down. The steroids, the work of the steroids, just to let the strength go upper than 7, 8 years of age, in which they generally could stop walking. With steroids, you can try to let them to walk until 10, 11. If I'm not happy about this schema, I start with every other day. Otherwise, I do every day. It depends. So, you know, it's the clinician that decide which is the best schema for that boy. It depends by the results. Sometimes, you know, I've seen patients with Duchenne that has been taking for 3, 4 years every day steroids. Then they are very fat. They have a lunaris face, and no one checked, for example, whether this schema was really necessary or not. For example, it's not just give steroids that you solve the problem. You have to do a lot of tests to understand if that schema works. If it works, you don't need to give a lot of steroids to the body. So it's a very the therapy is subjective. It's very subjective.
Маргарита, чи є питання у батьків?
Margarita, do parents have questions? I see a question in the chat. They ask, Mr. Professor, have you ever noticed in your practice iatrogenic steroid myopathy, due to which you had to stop treatment with steroids? If so, how frequently do you see such cases?
Well, you know, iatrogenic myopathy exists. There is a form when you give steroids to a normal person and you give steroids for a long time, you can have an atrophy of the type 2B fibers of the muscles. In that case, you can speak about myopathy, iatrogenic myopathy. In Duchenne, the iatrogenic myopathy does not exist. Practically, what you can have is only side effects of steroids. And for this reason, it's very difficult to understand whether Duchenne is eventually a iatrogenic myopathy. What you can do is just check whether the steroids help or doesn't help a boy. So as I said before, when you give steroids to a boy, you have to check it. And you cannot give steroids and then see the boy getting fat, doesn't the strength didn't improve, he will have a bad osteoporosis. So in those cases, we can call iatrogenic side effects. In that case, you know, you have these problems because no one was careful to check the side effects, you understand? But iatrogenic myopathy in Duchenne practically is impossible to detect. You can have iatrogenic side effects. You can speak about iatrogenic myopathy, whether, for example, in Duchenne, you give steroids and after 6 months, the strength of that boy decrease. In those cases, you think that probably the steroids has a bad effect, but this is not my experience. I never seen such things. I give also steroids when they stop walking. But in that case, generally, I try to give less steroids. So I'm not following more the schema that I follow when they walk. Because when they stop walking, it's important to give steroids yet, because probably it's important for the heart, for the lungs. But you don't need to give steroids, kilos of steroids, also in a child when start sitting, and the results are good.
Скажіть, будь ласка, в мене
Could you please tell us? I have a question. Right now, there are a lot of children in Ukraine, and probably most children in Ukraine for a few years take corticosteroids. So right now we have a different question about the fact that these children have problems with the bones and develop osteoporosis, and very often these children fall and they have bone fractures. Could you tell us, please, what are the main risks of fat embolics, or?
Yeah, allora, fat embolia is a very bad situation. I got in 20 plus years of experience only 2 cases and of fat embolia. Fat embolism, you can have a fat embolism in Duchenne, also with the very light trauma. You don't need to have fractures to have a fat embolia, because if you have also a light trauma, sometimes the muscles, because there is a lot of fat, can break. So in that case, you don't see fractures, but the boy gets respiratory insufficiency. The problem is that because these boys can change their situation in few hours. You see a boy that is okay, 98% of saturation, he fall, and after a few hours, it gets incredibly bad. And he starts to have a tachycardia, he starts to have, for example, respiratory insufficiency. And then you go to the emergency room. If they don't know what is a fat embolism, the boy died. Because most of the time when you have a fat embolism, the boy died. Because if you don't intervene immediately with transfusion, with special ventilation, you lose the boy. So fat embolism is risky, but I have to say the truth that in all my experience, hundreds of Duchenne, many of them fall, and a few of them they got auto fractures. I got only 2 cases. So probably we have to understand why fat embolism is rare in the rare. Many times you fall, you don't get any fat embolism, and other times you do a stupid fall in which you don't think anything, and then you get fat embolism. But the important thing is that you have to know it. And if a family is in difficulties and see the boy that changed completely after a fall, should call immediately the doctor, and the doctor should call immediately the emergency room to tell colleagues, wait, could be this, because really it's a very, very difficult diagnosis. Very few people know about fat embolism. You understand? About osteoporosis, I have to say the truth. Generally, in the past, when we give steroids without doing any check, many times the boys got fractures of the somatic vertebra in the trunk. So, and they had always pain, because, you know, when you have osteoporosis very, very severe, you get pain. But in the last 20 years, I didn't get any more bad osteoporosis. Of course, everyone has osteoporosis of them. But important is that they don't get spontaneous fractures. When you have spontaneous fractures, it means that you have very bad osteoporosis. Then you can do densitometry. The densitometry, once a year, you do densitometry. It's not always easy to do densitometry because you have to have also experience in people 7 years old, 8 years old, and many times densitometry is made for women, for adults. Who does densitometry has no experience with the kids. But anyway, this could be a good exam. You do it until they walk, then it is not necessary, at least for what is my experience. So we can check, but give vitamin D, give a bit of calcium. If you give calcium, tell the parents, let him to drink more, because sometimes you have stones in the kidney for calcium. Because these in Duchenne, especially when they stop walking, they don't like to go to the bathroom because they have to go by the wheelchair to the toilet. And these, for many times, they don't go to the bathroom because they don't want to get noise, or because, you know, they have to do something and they get bored to go in the bathroom. But it's very important to give more water to them because they don't drink much many times. If you give calcium, you have to give a bit of more hydration. Then you can give a biphosphonate. For example, from the age of 10, I give a biphosphonate in low dosage, but I give them. Today, in some hospital,
sorry, biphosphorate?
Biphosphonate. Today, in some hospital in Italy, because you need to have a public hospital or at least a university hospital, they do also biphosphonate intravenously, in case there are studies on it. But for what is my experience, with vitamin D, calcium, and biphosphonates, when you start, not when a boy is 30 years old, but for example, when he's 12, 13, it's a very good choice. And I didn't see bad osteoporosis in the last 15 years. Okay.
Мене таке питання.
I have one more question. The UK, Great Britain, doctors provide consultations to parents about injections, how to give injections to a child, or hormonal injections in case when the child cannot take the pill or swallow the pill. Is this practice used in your hospital or in general in Italy?
Well, in my hospital, not. I think it's very invasive, and I never got a child that doesn't can take pills. So we have drops. So we give the Flazacort in drops, and many times they put the drops in the Nutella or in mortadella, and then they take the drops. But I never give injection of steroids because they cannot take pills of drops. I think this is a very invasive way to give drugs. I don't like much invasive way, so I don't do it.
Зрозуміло.
It's clear. Can I ask one more question? Because I have a few questions to ask, but please, the floor is yours. One more question from the chat, probably from parents. Could we ask you, what is the approximate price to stay in the hospital for children from Ukraine, in your hospital, as I understand?
Yes, tell the parents that, you know, I don't like generally to speak about this because, you know, it's not my fault. But if they want, they can write me an email, and probably I will ask the hospital if they can do a special price. I don't know. But now to speak about price today is not really the target. Generally, one day probably could be the cost of, I don't know, 400 euros a day, more or less. But really, I cannot be sure because I arrived in this hospital 2 months ago, and I have to understand something. But tell the parents if they are interested, they can write me an email. Okay. But you should stay in Ukraine, not come in Italy.
Володимире Юрійовичу, будь ласка.
Дякую. Ну, я хочу знову ж трошки...
Then again, I want to receive some professional opinion from Professor, if I may. So I want to ask you the following. Since we understand, and that's absolutely right, we understand that there is the practical experience about all the methodologies that are used in treatment. Let's take physical therapy. And it was emphasized in your speech that there are more weak muscles, stronger muscles, and you clearly know what muscle groups suffer more, and specific approaches appear. So my question is, are there some polished off methodologies of physical rehabilitation, or is it your personal work result? As an example, for example, for many years we heard that voltotherapy methodology is used in treatment of patients with Duchenne disease. As an example, could you please share this experience with us?
Well, I say that the most important thing is that you have to avoid retraction. Now, I generally suggest to the parents the best sport they can do is also swimming. Swimming is very good because, you know, you move the muscles, you don't push much on the bones. Of course, you have muscles that are weaker and you have muscles that are stronger in Duchenne. For this reason, what you have to do is to try to keep the length of the limbs as straight as you can, because if for example the lower limbs will develop bad retraction, that the boy will have problems to walk. The physiotherapy is important, but you cannot change a lot the natural history of the Duchenne muscular dystrophy with physiotherapy, manual physiotherapy. You really need to put orthesis. The physiotherapy can be good because anyway you move better some limbs. Generally you cannot move much, and this gives also to a boy a good feeling. And for example, the physiotherapy can be very good for about the respiratory physiotherapy, because we do a lot of hyperinsufflation exercise to make stretching of the respiratory muscles. We do it with the calf assist. So if you have a calf assist machine, you take away the negative pressure, you use only the positive pressure. In that case, you can hyperinsufflate the lungs, and then you can make a very good physiotherapy. And we have seen that when you start chest physiotherapy already at the age of 10, you have good results. Probably you can delay the necessity of non-invasive ventilation. Well, some of my patients did this kind of physiotherapy. We have seen that they delayed the necessity of ventilation. For the rest, you have to use orthesis. You need to have a good orthopedic clinic in which they can do good orthesis. For example, the ankle foot orthesis are very important. And they have to be light, they have to wear very well the foot of the boy, and they have to be well done made. In that case, the child will accept. And when you put them during the night, you can be sure that the foot will be always in a good shape, at least until the age of 10, 11. So you don't need to do surgery. The same for the corset. For example, you know, it's probably, there are other, as I said before, there are other colleagues that will tell you, no, don't put a corset because you don't need. This is not true. So the corset is very important, should be made very well. So you have to respect the ventilation when you do the corset. Our technician let the patient breathe, because, you know, if you don't do a good corset, they can, or you can also make in difficulties the lungs, because if it's not good, it means that the lungs cannot work very well. But if you do good corset, if you do it when the child stop walking and start to sit practically all the day, can be very good also for the scoliosis. Then the standing is very important. So we work on orthesis, we do physiotherapy, because physiotherapy is very good, because psychology also, because you can try to avoid the retraction, but you need really to do physiotherapy every day. Many times the health system pass just once physiotherapy a week. Practically is very ridiculous. Also in Italy, happens like that. There are families that go to the health system and they give, you know, I give you physiotherapy once a week. You understand that the once a week doesn't do anything. And sometimes they tell, you know, it's the family that should do physiotherapy. This is not correct. A mother is not a physiotherapist. So the mother, okay, is a mother, but cannot make the work of physiotherapy. This is just a way to try to avoid expensive from the state, but this is not correct, because it's their right to have a physiotherapy. I do a lot of work about this. And when I listen some, you know, bureaucratic office tell to the mother, yeah, but you should do yourself the physiotherapy. Say, no, the physiotherapists make physiotherapy. The mothers does the mother. Yeah, the mother can do something, but the mother has already a lot of things to do. I don't know if I answered your question. But, you know, I work orthesis.
Абсолютно дякую. І я в зв'язку з цим хотів запитати.
Thank you very much. You fully answered. And I would like to continue my question. Do you use in your practical experience, do you use machine physiotherapy, like vibrostimulation of muscles, some perifine application, some electrophoresis?
Yeah.
How do you use these devices, some devices, any devices for physiotherapy?
Well, generally, I do not use this kind of device. You know that electrostimulation, there were studies was very bad, because, you know, when you use this device, you can stress the muscles much more. For example, electrostimulation is not good for Duchenne. I never use vibration, and someone say that vibration can work. Probably in Milan, there is a work now on a vibration platform for these kids, and probably they say it can be good for the bones and to avoid, for example, worse osteoporosis. But in my unit, in my hospital, I never use machine for Duchenne. We work with cyclo ergometry. We work with a lot of manual physiotherapy, orthosis. But actually, until now, I have no experience with the device. I never used.
Дякую вам.
Thank you very much. And I also would like, finally, I would like to ask you the most complicated question. This will relate to the following. Are there any protocols by Professor Marcello for treating Duchenne patients, children in particular?
Well, you know, I never made a protocol myself because I have no unit with many people working with me. And generally, I try to follow protocols that were made in the United States, in France, and I try to improve some of them. But to make a protocol is very difficult because, you know, you need many years of follow-up, and then you need the people, you need a lot of time to take all the data. Unfortunately, until now, well, I published some paper on the ventilatory problems, but I was not able to write a protocol myself because it probably does not exist a Villanova protocol. What I can tell you that the families are happy and the boys are happy, and I have a lot of adults with Duchenne. We work on the families, on the boys. But if one day I will have a big institute, then probably I will try also to write a protocol. You know, the pity is that I have not many people work with me. If you come in Bologna, you will see actually I'm alone with only physiotherapists. And for this reason, you have not much time. You have so many things to do every day in the hospital. And then you should need really as a research team to do and to work on this protocol. But I don't think I said something different from other centers. More or less in the world, we do all these things. I was the first in Italy to bring in Italy the cuff assist. When I arrived in 2000 from Newark, from John Bach in Italy did not exist the cuff assist. And when I started in 2000, I was a neurologist. The people, also colleagues, try to tell me, you know, this is a neurologist, he's not a pneumologist, he doesn't know anything. This machine the Duchenne doesn't need of this machine. So I had a lot of people against because, you know, I was speaking about cuff assist. And now everyone uses cuff assist. And as Bach said, in the medicine, when you do something new, everyone gives you, is against you. Then after all, they say always that they always did it. This is a teaching from medicine. So I did a lot of work during my life, and still I make a lot of work, bureaucratic work, fortunately, not work like yours, to let the people, to let the bureaucracy respect these families. There is no respect.
Дякую вам. Я думаю, що
Thank you very much. I'm sure that ahead you will have a big team of experts, of specialists, and people, your colleagues and bureaucrats also will listen to you, and you will have an opportunity to draw and write many protocols, not just one. Finally, I would like to ask you my last question. What is, according to your belief, Professor Marcello, what is the criteria for efficiency of helping a Duchenne patient? What is the criteria for assessing whether the medical aid to such patient is efficient?
Yeah, well, you know, yeah, I don't know if if understood very well your question, but if your method is efficient, then you see immediately how long they work, how long they live, how good is their quality of life, and also the best method to understand if your method is correct is that you have to prevent. You should never arrive when the ejection fraction of the heart is 30, and you see it for the first time your ejection fraction that is 30 of the heart. You should do the follow-up, you should check everything, and I think the best method is just to try to avoid problems, unnecessary problems. Otherwise, unfortunately, the Duchenne die. But today, what we want is that we want to prolong their life as much as we can. And we want that these boys become adult and they have quite as much as possible a normal life. So this is the best method. If you work with the heart, and if you work knowing that you are trying to do the best, you are applying the best thing in the world for that boy, then your method is okay.
Я вам дякую за вашу відповідь.
I thank you so much. Oksana, the floor is yours back. Thank you very much. I also have two questions actually, but I'm interested that since there are now, since physiotherapists are lacking in Ukraine, most of this physiotherapy is done by parents in Ukraine. So what about Italy? What is the sequence in your case? After you gave recommendation, how much work is done by parents, and what is the involvement of the physiotherapist?
So fortunately, in Italy, everyone can get also physiotherapy by the health system. So generally, we teach parents to do a bit of physiotherapy, but most of the time they do physiotherapy in places where you do physiotherapy, so they don't do physiotherapy at home. When a boy walks as a child, what I ask, just let him to go in a swimming pool if you can. Then they use orthesis at home. So we let the parents know how to do, for example, stretching of the ankle, but they don't do it at home. So there is always the possibility to go to do physiotherapy out of their house. So the parents are involved because they follow everything. And when you live in a place where, for example, the first place where you can do physiotherapy out of your house is 100 kilometers from your house, then in that case, you do physiotherapy at home. But most of the time, you know, is not very good that mother does physiotherapy, because many times the boy doesn't like much. And probably you should do so many hours of physiotherapy to get results that I prefer in those cases to give orthesis. But families are involved, are 100% involved in all the stories. In Ukraine, you do everything yourself, so you don't have the possibility to do physiotherapy in places where physiotherapists do it. So the mothers does everything at home, so you do physiotherapy at home for these kids, or I don't know.
Yes, in most cases, because in Ukraine, we don't have enough physiotherapists, and besides physiotherapists who knows how to work with children with neuromuscular diseases, there is such problem, and we really try to find the way how to train physiotherapists so that they would get to know these particularities.
Yeah, but remember that when you use orthesis, for example, if you put orthesis when they are really 3 years old and orthesis are good and they walk much longer, the good physiotherapy for them is just to walk. And if they have good feet, it's okay, it's good physiotherapy. So don't believe that the physiotherapy, the end of physiotherapy, manual physiotherapy will change a lot the natural history. No, the natural history of these boys will change if you use also orthesis and if you let them to walk longer. So they will have less scoliosis, they will have less retraction. For example, when they stop walking, you don't put them on a wheelchair and finish the story, because in 6 months they will have a retraction of the hip flexors, of the knee flexors, of the tendon Achilles. When the retraction of the lower limbs are bad, they will not sleep very well. They will call the mother 10 times, 20 times a year during the night, because you have to move them, because they have so bad retraction. The quality of the sleep is not very good, and the quality of the sleep of the parents is not very good. Remember, better is the condition of your son, better is the life of the parents. Because many times, if the boy sleeps when he's 20 in a good position, they will not call the parents 10 times, 20 times a night, because they want to move that, put a pillow there, put a pillow there. So you understand that it's very important to avoid bad retraction. If you let's stand them also when they lose the possibility to walk autonomously with the standing frame or with the wheelchair, you will see that their life will be much better.
Дякую.
Thank you.
Ой, я питання хочу задати.
I have a question, if I may. Maybe it's going to be the last one. Please tell us, in what case would you recommend for parents to give the child the stress dose of steroids, or is it impossible for parents to do it, and it can be done only upon prescription of the doctor?
Well, I have to say the truth, I never use stress dosage for steroids. So generally, when you do such thing, it's better to do it in a place where you know you have a medical care. For what is my experience is not really necessary. These are trials that are made to understand better if the steroids work or doesn't work. You know, unfortunately, we have not yet a good job that tell us which is the best dosage, and despite the fact that are more than 20 years that we use steroids, we don't know yet if we give 0.5 milligrams to kilograms to the kids, if it is the same as to give 0.75 prednisone, for example. Because most of this research in the last years went on the genetic therapy. And nobody studied more the steroids. Now, in the last year, there are a few trials that are trying to study the better dosage, because probably these kids, they don't need to have 0.9 milligrams per kilo of the Flazacort or 0.75 prednisone per kilo. Probably they will go also very well with 0.5, but we always give 0.75, 0.9, because we learned by the trial that was the dosage. But those trials are not well done. So I think that we have to learn still a lot about steroids, and probably this kind of stress therapy gives once a week. They are all tentative to understand if we have a better schema to give steroids to the kids. You know what? if you give steroids 10 days yes, 10 days no, you try to save the cortical surrenal gland, because if you give steroids for 10 days, then you can stop it. The cortical gland will not suffer. If you give steroids every day, then you will suppress the production of our steroids, because we produce ourselves steroids. And for this reason, this can become more problematic in the course of the life. For this reason, I start with a schema that doesn't give a lot of noise to the normal physiology of the boy or the kids.
Дякую.
Thank you.
Okay.
До завершення наша зустріч.
We are about to finish our meeting. It went very quickly. Thank you so much for all the practical advice to treat our children. So I want to wish you to have Merry Christmas and Happy New Year, because holidays are coming, and really it was very nice to listen to your presentation. Mr. Volodymyr, could you say a few words? Please unmute yourself. With pleasure, I join the words of Oksana, and my personal wish is to have the possibility to listen to your practical experience in Ukraine among the specialists and parents. Maybe I have no right, but I want to sincerely thank you for the help which is provided to the Ukrainian people in their difficult fight with the Russian aggressor. Thank you so much for your help, and we look forward to seeing you soon in 2023. Thank you.
So
Thank you.
I thank you very much. For me, it's been a great pleasure to be here. I hope really for Ukraine to solve all the problems, that you start to have again a normal life. You see, as a colleague, I work in a trench. It's like war. I work in a trench every day. So when I speak because I have people that show me these results. So I don't have much time, unfortunately, to write papers and papers, because I have a lot of work every day. But if someone of you want to see the reality, I will be very pleased to let him to come into Bologna and see these kids, this family, and in that case, also with colleagues from Ukraine, we can have a really very concrete collaboration. And I invite you, the colleague, the professor, to come to Bologna once. We can spend some days together. So we can speak about many things, and I can show you how we work on these families, okay? So Merry Christmas to all of you, and thank you again, and it's okay.